Now talking about the hypothyroidism. What is the hypothyroidism? It is a thyroid problem caused by the underactive thyroid gland that produces insufficient amount of thyroid hormone. It means thyroid hormone decreases. It may also develop from the pituitary deficiency. It means it is more likely due to the inborn error of the thyroid gland. Hypothyroidism is seen in both sexes but is more common in women. In pregnant, the newborn is at the risk of hypothyroidism. The basic symptoms of hypothyroidism is weight gain, dry skin, hair, houseflies, fatigue, cold intolerance, puffy facial feature, but these symptoms are minor as compared to the effects the thyroid deficiency can have on the body since every cell in the body needs thyroid hormone. Because the symptoms may be varied and difficult to define, often stimulate other conditions. Many people with an underactive thyroid gland may be completely unaware of the problem. Some of the complications have been treated by the hypothyroidism or diabetes, high blood pressure, emphysema, arthritis, depression, frequent infections, and migraine. Some classification has hypothyroidism. You can see has the primary, secondary, tertiary, and quaternary. The primary due to the failure of the thyroid gland cells, and secondary is due to the hyperpituitarism. It means the pituitarism has deficiency of the pituitary, and tertiary due to the failure of hypothalamus. Okay, and the quaternary is due to the tissue insensitivity to action of the thyroid hormone. You can see here in diagram at the hypothalamus. Okay, at the hypothalamus you can see here hypothalamus. It means that the have a TRH released by the hypothalamus. Okay, then TRH is the pituitary gland, then TSH, thyroid receptor hormone, the pituitary gland, then TSH, then the thyroid gland, and T3, T4, the blood T3, and T4, 3 are the bond, so CBG, albumin, the liver, then we are on kidney, then other target tissue. Okay, then now you can see here in the secondary it is the deficiency of the pituitary, then the secondary you can see here in the secondary, yeah, secondary is here, tertiary is hypothalamus, and primary is there thyroid gland. Here are some classifications, or we can say some stages of the hypothyroidism. And goitrous hypothyroidism. What is the goiter hypothyroidism? Excessive stimulation of the TSH, which is the decreased levels of circulating thyroid hormone, leading to the enlargement of thyroid gland with iron deficiency and certain anti-thyroid drugs and Hashimoto's thyroiditis. Natural diet of the hypothyroidism. Essential fatty acids are anti-inflammatory and necessary for hormone production. Then the flaxseed oil 3 grams per day we can use 1000 to 1500, and seaweed, fish, and logs should also be consumed frequently. They are rich in iodine, essential nutrients that maintain the thyroid function balance. Selenium-rich foods or garlic, the mushrooms are important for peripheral conversion of T4 to T3, also regulate the amount of the hormone produced. The natural diet of the hypothyroidism, the calcium, the magnesium, the daily actions you can see here some, try to be regular physical activity, exercise, and the hormone levels should be monitored on a regular basis, and perform a daily thyroid self message, and generally stroke up or down the sides of the question. To avoid anti-thyroid foods as well. Some herbal remedies, focus vesiculus and ayuna sativa, foliage vesiculus, they are some benefits from you. And now we discuss here some discuss about the plants, how it is very important for hypothyroidism. Now some study about the assessment, okay, the medical history about healthy and hypothyroidism. This is all about the hypothyroidism, and thank you so much for this today. You can have now about the hypothyroidism. The pituitary gland, you can see at the corner, at the right corner, this hair. The pituitary gland dysfunction, the central hypothyroidism, which is the T6 secretion. Okay, and if the T6 secretion is decreased, then the inappropriate normal T6 in the context of the low T4 and T3. If you can see here some hypothyroidism, it also may cause the hypothyroidism. Okay, they have some progressive autoimmune destruction of the thyroid gland. Okay, then the decrease the secretion of the T4 and T3 from the thyroid gland because the progressive autoimmune destruction of the thyroid gland. And how these secretions are being produced from the thyroid gland? That's why the decrease the secretion of the thyroid T4 and T3. Then this may cause it to decrease the aneuploidy effect of the head and decrease the contractility and rate of the contraction of the cardiac myocytes. Then may cause it to the heart gland. If the pituitary gland is functioning normally, then T4T3 stimulates TSH release from the pituitary gland, and TSH is primary hypothyroidism. Okay, because they have increased the TSH, but the thyroid gland is destroyed, and TSH is increased, which means the primary hypothyroidism. Okay, now you can see here in the decrease of T4T3 from thyroid gland, some lot of changes we have done on. One is the loss of vasodilated for the T3 here. Okay, they increase the peripheral vascular resistance and it increase the diastolic blood pressure, which has narrowed blood pressure. Okay. In another see has it decrease the basal metabolic rate. Okay, which may cause mesogenous coma and mental status and weight on fatigue and cold intolerance and dry skin and decrease the blood respiration as well. Okay, and we decrease the chromosomal secretion in the skin, so glandular secretion in the skin, which may cause dry skin and respiration as well. And we have to take motility and which also decrease the cause constipation. Okay, and we increase the glucosamine glycan, which is matrix protein deposition in the tissue, deposition in the skin, in the larynx, which may cause thickened skin and the house speech respectively. It may also expression of the LDL research, decrease the lipid protein, decrease LDL metabolism as well, and decrease the lipoprotein activity. You can see here, lipid metabolism, which causes the hyperlipidemia and speech. As well as increase the LDL circulation in the blood. You can see has some important unknown mechanism also used. Also, it is also produce some symptoms, neurological symptoms, abnormal heavy menses, infertility, and muscle cramps, and joint pain, and poor muscle and tone, and hung, reflexes with delayed relaxation and so on. And transit, you can see iatrogenic drugs as well. Some how is the impaired function of the thyroid gland, the decrease the secretion of T3 and T4 happens. Now these are all about the hypothyroidism.